Hello once again, and welcome back to Ask the Doctor. I'm your host, Mike Berger, and today we're joined by Dr. Charles Powell of Healthcare Associates of Irving. And we're talking about Medicare, healthcare, and the wellness for those of us over 55 and older. We'd like to remind you to join in. Just call the number that you see on your screen. That's 1-877-563-0099, or you can email your questions to cpowell@healthcareassociates.com. This time for a viewer and a question on the website, Scott in Irving asked, how can I learn more about the educational information available to me to help manage my diabetes? And I would imagine, Dr. Powell, not only would this pertain to diabetes, but to a number of other health issues.
Absolutely. You know, this brings up a very important topic of our patients are becoming more educated. The internet has allowed such an opportunity for people to self-educate, which is good and bad.
Sure.
You know, they come in and a lot of my work's already done, but at the same time, it can sometimes instill some fear into them when they research some of these topics. But I will tell you that, you know, at least through our practice of Healthcare Associates in Irving, we thrive in making sure that we have diabetic educators. We make sure that we have the appropriate educational material that's needed for all sorts of disease states, not just diabetes. But let's step outside the equation of just the doctor-patient relationship, which is so valuable, and understand too that the health insurance companies are now starting to realize how important this is. They're establishing a relationship with you as well. Never forget to ask not just your health care provider, but also your health insurance, whether it be a Medicare Advantage plan or some other commercial insurance. What can they do for you? Because they want you to be educated as well.
Here's another email question. It comes from Lisa in Mesquite, and she would like to know, what medical illness could I have and not know it? Can a doctor tell that I have a problem? That could cover a broad spectrum, could it not, doctor?
It could, and you know, in the last segment we briefly talked about the silent killers, you know, the high blood pressure, the high cholesterol, the heart disease that has no symptoms up to that point. And so many times I get clients in that I'm trying to convince them, okay, we need to take care of your diabetes and your blood pressure now, and I get the comment back, but I don't feel anything, I feel fine.
Sure.
And I have to convince them that we have seen that endpoint and we don't want them to follow that path. So back to these, quote, silent killers. There's a whole list of them, and that's what the preventative maintenance physical exam is for. When you see your health care provider, like you would see one of us at Healthcare Associates of Irving, our goal is to use that annual physical to try to help identify one of the numbers of silent killers that can lead to endpoints, you know, months, if not years down the road.
We're going to take a short break again. Time is flying, but certainly stay with us. And if you have any questions, again, call us at 1-877-563-0099 or email us at www.healthcareassociates.com.